Local voices, statewide impact. It's Daybreak with Brian and Jamie.
It's 8:22 right now. Thank you so much for joining us this morning. My name is Jamie Martinson.
And good morning, I'm Brian Noonan. According to the Wisconsin Department of Health Services, about 1 in 11 people in Wisconsin are living with diabetes. Once considered an adult disease, type 2 diabetes is being diagnosed more and more often in children and teens. UW Health reports that a 10% increase in youth cases in diabetes since 2018. The mission of the Wisconsin Lions Foundation is building a healthier Wisconsin through awareness, action, and support. Here to tell us about some of the Lions Foundation's programs is Amanda Daly. She's the healthcare supervisor for the Wisconsin Lions. Amanda, thank you for being here. We appreciate your time this morning.
Thank you so much for having me.
So give us a little history on the Wisconsin Lions Foundation and what you do there.
So I am the healthcare supervisor for the Wisconsin Lions Foundation, but I am mainly for the Wisconsin Lions Camp, which is a summer camp founded in 1956, serving youth and adults with disabilities. So we offer our camp for free for people who are eligible for it. Applications are open right now and are through May 15th if anybody is interested.
Well, we are interested.
Yes. Well, and in that role, because I'm a registered nurse, I took over the coordination of our diabetes awareness project. And diabetes awareness, when we started the project in 1998, was not as prevalent as it is now. It was kind of nobody really talked about having type 2 diabetes. Nobody talked about any kind of diabetes. So at that point, we had some grants from the state, and we created a robust library of reference documents to help spread the word through our local Lions clubs about diabetes and risk factors and living with diabetes and all of these things. And it was wonderful. But fast forward, it is now 2026. The word is out about type 1 and type 2 diabetes. Everybody knows about it. People can hear about it from much more credible sources than the Lions Foundation. So we decided to shift our focus. Working with our diabetes committee at the state level, we wanted to use our time, our efforts in a more impactful way. We wanted to be able to help more people on a day-to-day level. Part of my background is before entering this role, I was a school nurse. I was a school nurse for about 8 years. In that role, I worked with a lot of students who had diabetes, type 1 and type 2. There are
Amanda, real quick, could you just, for those who still don't know, can you explain the difference between type 1 and type 2?
Absolutely. Okay, so type 1 diabetes is an autoimmune disease where your body decides it doesn't like your pancreas anymore. It especially doesn't like the cells in that pancreas that create insulin. And insulin is a hormone that you need to get sugar from your bloodstream into your body cells for them to function. So in type 1, your body doesn't make it anymore. It's gone. So the only way that you can get it is by supplementing it from the outside with either injections, continuous infusion pumps, those kinds of, that kind of stuff. And then you are constantly monitoring your blood sugar because it's going up and down, and you're having to balance what you're eating with what insulin you're giving so that you're not getting too high or too low, because both of those things can be dangerous. With type 2 diabetes, your body and your pancreas, they're still making insulin, but due to genetic factors, lots of things, your body cells no longer, the same amount of insulin doesn't work as effectively. So you're having to still sometimes take insulin to increase the efficacy of that insulin. So they both require you to take insulin sometimes, but one is an autoimmune disease. One is it's still a metabolic disease, but it's not something that can be you can avoid type 2 diabetes with diet, exercise, medication. Type 1, you got it.
And are kids with both types, are they eligible for the camp?
100%. We have 2 weeks of diabetes camp, and we can have up to 150 campers each week. Our weeks this year are June 14th through 18th and June 21st through 25th.
We're talking with Amanda Daly. She is the healthcare supervisor for the Wisconsin Lions. You also, a few minutes ago, mentioned grants. You actually have grants that go out to the schools so they can help students with diabetes. Can you tell us about that and how schools apply? And is that open to any school in the Wisconsin school district?
Absolutely. Yeah.
Okay.
It is. So new this year, like I said, we wanted to be more purposeful, impactful. So we started the grant. Schools who are monitoring students with diabetes through continuous glucose monitors. Like I said, you have to monitor that blood glucose as it goes up and down. Schools can monitor those blood sugars remotely from these devices. So you can do that if you have devices that can do it. When I was a school nurse, our school couldn't afford to buy me the tablet that we needed to monitor those things. So it was kind of, you're just having to rely on that student paying attention to those things, or a parent has to do it from afar and they might be working or doing that thing. So as a safety issue, it's the best thing that you can do is have access to those blood sugar numbers so that you can watch them as they're going up and down. But like I said, some schools can't afford it. So we are offering our grant to help schools, school nurses, school staff, everybody monitor students with diabetes. So they can apply on our website, that the way flashed above, WisconsinLionsFoundation.org. Schools can apply for up to $1,000 to help monitor their students with diabetes. That can be tablets, smartphones, that can be Wi-Fi upgrades, all those things that we need to really help with that student safety. Any school in Wisconsin can do it. You just have to apply for each school individually. And the person who applies has to be from the school. Parents can't apply, but parents can encourage
tell
apply.
Your school to apply. And if you think your child might want to go to the Lions camp, WisconsinLions.org, you can get all the information on the camp. You can get the information for the grants. You can get all the information on the great work. Amanda Daly, thank you for being with us this morning. Congrats, you get your first interview done.
Woohoo! Thank you so much.
All right, we're